Welcome to Healthcare UK, your trusted source for clear, evidence-based health insights from the front line of UK healthcare. I'm Leda, a registered nurse. If you value credible health information, make sure you subscribe and hit the notification bell so you never miss an update.
Question 1. A patient scheduled for surgery expresses significant anxiety and states, "I'm terrified of the anaesthetic." What is the nurse's most therapeutic response? A. Don't worry, modern anaesthetics are very safe. B. I will ask the anaesthetist to come and speak with you about your concerns. C. Many people feel anxious before surgery. It's a normal feeling. D. Can you tell me more about what specifically is worrying you? Answer D. Explanation. This is an open-ended therapeutic question. It validates the patient's feelings and invites them to share their specific fears, allowing the nurse to provide tailored support and information. Answer A provides false reassurance, C normalizes but dismisses the specific concern, and B is a helpful action but should only come after the nurse has first explored the patient's feelings. Question 2. You are preparing to administer a scheduled dose of digoxin. Which assessment is essential to perform immediately before administration? A. Check the patient's blood pressure. B. Measure the patient's respiratory rate. C. Auscultate the apical pulse for 1 full minute. D. Assess the patient's level of consciousness. Answer C. Explanation. Digoxin slows the heart rate. A key sign of digoxin toxicity is bradycardia, a slow heart rate. It is a mandatory nursing practice to check the apical pulse for a full minute before administration. If the pulse is below 60 bpm or another specified parameter, the dose is typically withheld and the doctor is notified. Question 3. A patient with dysphagia is at high risk of aspiration. Which nursing intervention is most appropriate to minimize this risk? A. Encourage the patient to eat quickly to reduce fatigue. B. Provide thin fluids to make swallowing easier. C. Offer large bites of food to stimulate the swallow reflex. D. Ensure the patient is sitting fully upright during and after meals. Answer D. Explanation. Positioning the patient at a 90-degree angle, high Fowler's position, uses gravity to facilitate safe swallowing and reduces the risk of food or fluid entering the airway. Thin fluids, B, are often the most difficult to control and increase aspiration risk. Eating quickly, A, and large bites, C, also significantly increase the danger of aspiration. Question 4. According to the NMC code, what is the primary purpose of professional revalidation? A. To ensure nurses meet their required number of practice hours. B. To provide a mechanism for increasing a nurse's salary band. C. To improve public protection by ensuring nurses remain fit to practice. D. To catalogue all continuing professional development (CPD) activities. Answer C. Explanation. The fundamental purpose of revalidation is to protect the public. It ensures that nurses and midwives are keeping their skills and knowledge up to date and are upholding the professional standards outlined in the NMC code throughout their careers. While practice hours, A, and CPD are requirements of revalidation, they are components that serve the main goal of public safety. Question 5. A patient has a blood glucose level of 2.8 millimoles per litre. They are conscious and able to swallow. What is the most appropriate immediate action? A. Administer an intramuscular glucagon injection. B. Administer 15 to 20 grams of a fast-acting carbohydrate orally. C. Prepare an intravenous infusion of 5% dextrose. D. Give the patient a meal of long-acting carbohydrates. Answer B. Explanation: for a conscious patient with hypoglycemia, blood glucose less than 4.0 millimoles per litre, the standard immediate treatment is a fast-acting carbohydrate, e.g., glucose tablets, Lucozade, fruit juice, to quickly raise their blood sugar. Glucagon, A, or IV dextrose, C, are reserved for unconscious patients or those unable to swallow. Long-acting carbohydrates, D, are given after the initial treatment to maintain stability. Question 6. A healthcare assistant reports that a patient's surgical dressing has become saturated with blood. What should the nurse do first? A. Ask the healthcare assistant to apply a new dressing. B. Document the finding in the patient's notes. C. Go and personally assess the patient and the wound site. D. Telephone the surgeon to inform them of the situation. Answer: C. Explanation: the registered nurse's first responsibility is to perform a direct assessment. They must see the patient to evaluate the extent of the bleeding, check vital signs, and determine the cause before taking any other action. Delegating, A, documenting or reporting without a personal assessment would be unsafe and inappropriate. Question 7. Which of the following is the most effective single action for preventing the spread of healthcare-associated infections, HCAIs? A. Wearing gloves for all patient contact. B. Isolating any patient with a known infection. C. Performing effective hand hygiene at appropriate moments. D. Routinely cleaning hospital equipment between uses. Answer: C. Explanation: the World Health Organization and NHS guidelines identify effective hand hygiene as the single most critical measure to prevent the transmission of infections in healthcare settings. While the other options are important components of infection control, they are secondary to the fundamental practice of hand washing. Question 8. A patient refuses a prescribed blood transfusion due to their religious beliefs. The patient is deemed to have the capacity to make this decision. What is the nurse's primary responsibility? A. Try to convince the patient that the transfusion is life-saving. B. Ask the patient's family to persuade them to accept the treatment. C. Respect the patient's autonomous decision and inform the medical team. D. Proceed with the transfusion as it is in the patient's best medical interest. Answer: C. Explanation: a patient with mental capacity has the absolute right to refuse treatment, even if that decision may result in harm or death. This is a core principle of patient autonomy. The nurse's professional duty is to respect this decision, ensure it is well informed, document it, and communicate it to the wider healthcare team. Question 9. A newly admitted patient does not speak English. How should the nurse proceed with the admission assessment to ensure effective communication? A. Use a family member to translate sensitive medical information. B. Use simple gestures and point to the relevant body parts. C. Use an online translation application on a mobile phone. D. Contact the hospital's official interpreter service. Answer: D. Explanation: the gold standard for safe and effective communication is a professional, approved interpreter. This ensures accuracy, impartiality, confidentiality, and understanding of medical terminology. Using family members, A, is inappropriate due to potential bias and lack of medical knowledge. Gestures, B, are insufficient for a full assessment, and online tools, C, can be inaccurate and breach confidentiality. Question 10. You need to hand over information about a deteriorating patient to a doctor. Which structured communication tool is most appropriate for this situation? A. ABCD, B. SBAR, C. Must, D. News 2. Answer B. Explanation. SBAR, Situation Background Assessment Recommendation, is a widely used communication tool designed for clear and concise handovers of urgent patient information between healthcare professionals. ABCD is an assessment tool for emergencies, Must is for nutritional screening, and News 2 is an early warning score. Question 11. A nurse discovers they have administered the wrong medication to a patient. The patient appears stable. What is the nurse's immediate priority? A. Assess and monitor the patient for any adverse reactions. B. Inform the patient that an error has occurred. C. Inform the nurse in charge and the patient's doctor. D. Complete a hospital incident report form. Answer A. Explanation. The absolute first priority in any medication error is the patient's safety. The nurse must immediately assess the patient's vital signs and check for any adverse effects related to the incorrect drug. All other actions, informing others, documenting, follow after the patient's immediate condition has been assessed and stabilized. Question 12. Which of the following is considered the most significant risk factor for falls in older adult patients in a hospital setting? A. History of previous falls. B. Cognitive impairment or confusion. C. Use of four-wheeled walking frame. D. Being over the age of 75. Answer B. Explanation. While a history of falls is a strong predictor, cognitive impairment, e.g. dementia, delirium, is a primary risk factor because it affects a patient's judgment, awareness of their surroundings, and ability to follow safety instructions. A confused patient is highly unpredictable and at a very high risk of falling. Question 13. You are completing a fluid balance chart for a patient over 24 hours. The patient's intake was 1,500 millilitres. The output recorded was urine 800 ml, wound drain 150 ml, vomit 100 ml, one formed stool. What is the total output in ml? A. 1,050 ml, B. 1,150 ml, C. 950 ml, D. 1,250 ml. Answer A. Explanation. Total fluid output is the sum of all measurable liquid losses. Formed stool is not typically included in the fluid output calculation. Therefore, 800 ml urine plus 150 ml wound drain plus 100 ml vomit equals 1,050 ml. Question 14. For consent to a medical procedure to be legally valid, it must be A. Given by a patient who is over 18 years of age, B. Confirmed in writing on a designated consent form, C. Voluntary, informed, and given by a person with capacity, D. Agreed upon by the patient's next of kin. Answer C. Explanation. These are the three core pillars of valid consent in the UK. Voluntary, free from pressure; informed, the patient understands the risks, benefits and alternatives; and capacity. The patient is able to understand, retain, weigh and communicate their decision. Question 15. A nurse observes several unexplained bruises on an elderly patient with dementia during personal care. What is the nurse's most appropriate first action? A. Ask the patient's family if they know where the bruises came from. B. Report the concerns immediately according to local safeguarding policy. C. Take photographs of the bruises for evidence. D. Document the bruises on a body map and monitor them. Answer B. Explanation. Unexplained bruising in a vulnerable adult is a major safeguarding concern. The nurse has a professional duty to act immediately by reporting their concerns to the nurse in charge and the local safeguarding team as per policy. This initiates a formal investigation. Documenting and monitoring, D, is important but not the first action. Reporting is. Question 16. A patient's risk of developing a pressure ulcer is assessed using the Braden scale. A lower score on this scale indicates A. A higher risk of developing a pressure ulcer. B. A lower risk of developing a pressure ulcer. C. The patient already has a pressure ulcer. D. The patient has good mobility and nutrition. Answer A. Explanation. On the Braden scale, a lower score signifies a higher risk. The scale assesses sensory perception, moisture, activity, mobility, nutrition, and friction/shear. Fewer points in these categories mean the patient is more vulnerable. Question 17. A patient with a peripheral intravenous cannula complains of pain and tenderness at the insertion site. On inspection, the nurse notes redness and swelling along the path of the vein. These are signs of A. Infiltration, B. A properly functioning cannula, C. Infection, D. Phlebitis. Answer D. Explanation. Phlebitis is the inflammation of a vein. The classic signs are pain, erythema, redness, edema, swelling, and tenderness along the vein. Infiltration, A, is when the cannula dislodges and fluid leaks into the surrounding tissue, causing cool, pale, and puffy swelling. Question 18. The professional duty of candour means that nurses must A. Only report incidents that have resulted in severe harm. B. Be open and honest with patients when something goes wrong with their care. C. Obtain consent from a manager before apologising to a patient. D. Wait for a formal complaint to be made before discussing an incident. Answer B. Explanation. The duty of candour is a legal and professional responsibility to be transparent with patients or their family when a patient safety incident has occurred that could result in or has resulted in harm. This involves telling them what happened, apologising, and explaining the next steps. Question 19. A patient is having an acute asthma attack with severe shortness of breath. Which medication should the nurse expect to administer first? A. Salbutamol via a nebulizer. B. An oral corticosteroid tablet. C. A long-acting beta-agonist inhaler. D. Intravenous antibiotics. Answer A. Explanation. Salbutamol is a short-acting beta-2 agonist, SABA, that acts as a bronchodilator. It provides rapid relief of bronchospasm and is the first-line treatment for an acute asthma attack. Corticosteroids, B, are also used but take longer to work. Long-acting inhalers, C, are for prevention, not acute relief. Question 20. When communicating with a patient who has advanced dementia and is becoming agitated, which technique is most effective? A. Speaking in a loud, clear voice to ensure they can hear. B. Correcting their misconceptions to reorient them to reality. C. Asking multiple questions to find the source of the agitation. D. Using a calm tone and short, simple sentences. Answer D. Explanation. A calm, reassuring tone and simple language can help to de-escalate the situation and reduce the patient's cognitive load, making it easier for them to understand. Loud voices, A, correcting them, B, and asking many questions, C, can increase confusion and agitation. Question 21. According to NMC guidelines, which task can a registered nurse not delegate to a healthcare assistant, HCA? A. Assisting a stable patient with their personal hygiene. B. Administering a patient's routine oral medications. C. Taking and recording a stable patient's vital signs. D. Assisting a patient with their meals. Answer B. Explanation. The administration of medication requires the professional knowledge, judgment, and accountability of a registered nurse. It is a complex process that cannot be delegated to an unregulated practitioner like an HCA. The other tasks are appropriate for delegation to a competent HCA. Question 22. A patient has a National Early Warning Score News 2 of 5. According to standard UK protocols, this requires A. Routine 4-hourly monitoring to continue. B. An urgent response from a registered nurse or practitioner. C. An immediate response from the critical care outreach team. D. A routine review by the ward doctor within the next hour. Answer B. Explanation. A News 2 score of 5 to 6 falls into the medium score category, which requires an urgent assessment by a registered nurse who can determine the level of care needed and decide if further escalation is required. It is not routine, A, and does not typically trigger an immediate critical care response, C, unless other specific criteria are met. Question 23. A patient is 1 day post-operative following a total hip replacement. What is the most important nursing intervention to prevent hip dislocation? A. Encouraging the patient to cross their legs for comfort. B. Placing the patient in a high Fowler's position, 90 degrees. C. Keeping the patient's knees higher than their hips when sitting. D. Using an abduction pillow to keep the patient's legs apart. Answer D. Explanation. Following hip replacement surgery, adduction, moving the leg toward the midline, and excessive flexion must be avoided to prevent the new joint from dislocating. An abduction pillow is specifically designed to maintain the proper alignment and prevent the patient from crossing their legs. Question 24. Which of the following is a direct breach of the General Data Protection Regulation, GDPR, in a clinical setting? A. Discussing a patient's condition with another nurse in a public lift. B. Using a password-protected computer to access patient records. C. Handing over patient information to the next nurse on shift. D. Sharing anonymized patient data for a clinical audit. Answer A. Discussing personally identifiable patient information in a non-private area where it can be overheard by unauthorized individuals is a clear breach of patient confidentiality and GDPR rules. The other options describe legitimate and secure ways of handling patient information. Question 25. A patient with a urinary tract infection suddenly becomes confused, with a heart rate of 120 bpm, respiratory rate of 24, and a blood pressure of 90-50 millimeters Hg. The nurse should recognize these as key signs of A. Hypoglycemia, B. Sepsis, C. Anaphylaxis, D. A stroke. Answer B. Explanation. The combination of a known infection source, UTI, with systemic signs of organ dysfunction, acute confusion or altered mental state, tachycardia, tachypnea, hypertension, are hallmark red flags for sepsis, a life-threatening medical emergency requiring immediate intervention.
I hope that deep dive into CBT questions was helpful. If it was, a like would be amazing.